what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. In today's video, I wanted to cover the topic of Verteporfin for treating hair loss. I've done a lot of videos on Verteporfin over the past couple of years, and I realized that I really didn't do any follow-ups. And I think it's important that we go back and talk about Verteporfin again, because it is a treatment that was incredibly intriguing, as it was able to promote new hair growth on areas in the donor area that were extracted via FUE and also via FUT, and it had the potential to eliminate or greatly reduce fibrotic scar tissue. And if you guys remember, the hairs that are extracted from the back of the scalp during a hair transplant are not going to grow back. And this is one of the main reasons why people end up with tiny circular scars in the back of their scalps. This is the reason why hair transplants are also finite and why we only have a limited supply of hairs that can be redistributed to balding and miniaturized regions. So if you guys don't remember what Verteporfin is, it's actually an FDA-approved drug that was approved for treating macular degeneration. And the way that Verteporfin works is that it blocks the YAP pathway. And this is a pathway that is activated when there is injury to the skin. And this YAP pathway also activates another protein called ingrailed-1, which then activates fibroblasts that lead to scar tissue, also known as fibrosis. The important thing to note here is that fibrosis is going to lack hair follicles, and this is why, when you get a scar on the scalp or anywhere in the body, if you go through surgery, that scar tissue is not going to be able to generate hair follicles. The same thing happens when doctors extract hair follicles in the back of the donor area via FUE or FUT. It's going to be left with a scar that is unable to regenerate new hair follicles. However, when this mechanical signaling was inhibited through Verteporfin injections by blocking the YAP pathway, it actually encouraged wound repair without fibrosis, and surprisingly, it also was able to regenerate secondary skin elements, including hair follicles and sebaceous glands. Now, the last update that we had from Dr. Barghouti when he used Verteporfin on an FUE patient was that he set up 3 control and 3 test locations using various concentrations of Verteporfin. The TSC area where Verteporfin was injected, and the C here is the control group. The highest concentration used was 0.4 milligram. And I think for my last update video a couple years back, we followed up with the 4-month post-injection mark where there was clearly a distinction between the areas that had Verteporfin injected versus the control group. So just to recap, these are the images at 4 months post-injection, and you guys can clearly see improvement and new hair that are sprouting from an apparent extraction site, while the control zone shows nothing but scarring. And the best improvement is seen from the 0.4 milligram injection as opposed to the 0.32 and the 0.24 milligram. Although even with these two, you can definitely see improvement in the test areas and even hairs that are emerging out. Now, here is the 500-day post-op after the initial injection of Verteporfin using 0.4 milligram concentration. Remember that this is only after 1 injection of 0.4 milligram. And if you guys take a look at the image on the left, the treated area looks almost untouched despite having grafts that were extracted via FUE, while the 0.4 milligram control group has visible scarring. And this is truly amazing because to me, this is proof that Verteporfin does work in stimulating new hair growth as well as reducing fibrosis. A larger scale clinical trial is really warranted. The image on the right was from 0.24 milligram Verteporfin injection, and we can still see the FUE scars in both the treated and control group, which points to show that a higher concentration likely has better efficacy. Dr. Barghouti also updated on the use of several higher use of different concentrations up to 1 milligram Verteporfin in a more update last September, and I'll share them with you here. So 0.4 milligram area at 4 months versus 6 months, it's a bit hard to tell, but it looks like new hairs are growing. We just don't know if they're new hairs, and in this specific person's case, as a result of Verteporfin, we don't know if it's due to new versatiligen hairs or even partially transected hairs. Same thing that we see at 0.6, but it does look like some activity going on at the 6-month mark where you can see the tiny hairs circled in blue, which appears to be new hairs growing out. And then 0.8 milligram Verteporfin, which appears to show hair growing in an area that was void, but once again, we're not 100% sure whether this is actual hair resulting from Verteporfin. And then followed by 1 milligram of Verteporfin injection This is one of the highest concentrations that we have seen, and there does appear to be some unusual activity in the 6-week mark versus the 6 months. And Dr. Barghouti stated that it is worth keeping an eye for, as it can also be telogen hairs and not derived from verteporfin. And I think that the main issue here is that there is nothing that can really truly differentiate this type of hair. And one thing that comes to mind is that the previous study was using a much lower concentration and just one subject. There might be an upper limit when it comes to verteporfin, and going over that limit may actually hinder potential hair regeneration and fibrosis reversal. The other thing is that because these are done in a limited number of patients, results can obviously vary and might be dependent on a patient's own genetics, their healing capabilities, certain medications that they're taking, and just the list goes on and on. But since then, there has been a lot of hair transplant doctors who have been very intrigued and interested, and they've also been experimenting with verteporfin injections post-hair transplant. One of them happens to be Dr. Bloxam, and what he did was inject a higher concentration verteporfin into an FUT scar, revision scar, to see the effects it would have. This is the image. On the left is a hypertrophic scarring after FUT. There's about a 1 centimeter gap that's pretty well defined. It's very dense with fibrotic tissue. There's no hair growth. And then followed by the image on the right, which was taken 12 months after a high-dose verteporfin injection into the revision scar. Yes, the revision scar would make the linear scar much narrower. That's the point of that. But it also does not allow new hairs to regenerate. But what we see in the image here are new scattered hairs that appear to be growing from in between the scar. And the other thing to note is that there is far less fibrotic tissue, and it's more pigmented to the point where it kind of looks like it's regular scalp skin. Nevertheless, this is incredible to see that verteporfin is actually working in eliminating scar tissue and even possibly regrowing new hair follicles. There was also another post that I saw from a hair loss forum, and this was regarding a hair transplant doctor named Dr. Melissa Toyos, in which she herself had conducted 3 hair transplants in 2024 and claims that the regrowth rate in the donor area using verteporfin was around 20 to 33% growth. And I think this also aligns with what Dr. Barghouti found in his first trial. So all in all, I think this is incredible news, and I truly believe that verteporfin's mechanism of action is presumably valid, and that we should see more optimistic results as more and more doctors continue using verteporfin into their practice. I really hope that there is a large-scale clinical trial that would really commence so that we can get a better unbiased study, and this would really be a game changer in the hair transplantation industry if people are able to truly regenerate extracted hair follicles in the donor area. And that's been tested and proven through these clinical trials. Not only will you be able to really improve the aesthetics in the donor area, but potentially be able to regenerate new grafts, which can be used for, more grafts to transplant. I hope that there are more doctors out there that are willing to be testing this out, especially in places like Turkey, where the majority of hair transplants are performed. But let's keep our fingers crossed and expect to hear more optimistic updates in the near future. The other thing is that this would also open up doors to improving surgical scars in patients who obviously undergo surgery. Things like plastic surgery, scars are not going to be visible, and even perhaps for burn victims. But anyway, guys, this wraps up the video. If you had verteporfin injections during a hair transplant and have seen some pretty good regrowth, let me know in the comments. I would love to hear about your results. Make sure to share them with me. And once again, thanks for all of your support. And make sure to give this video a thumbs up. And I will talk to you guys in my next video. Take care, guys.